syndrome is a genetic condition that causes intellectual disability, behavioral and learning challenges, and there are various physical characteristics. This occurs in both males and females, although males are more frequently and usually more severe.
Most children with Fragile X have some sort of language delays. For Fragile X, their speech is compulsive, narrative, perseverative. Also, they have very short bursts of speech with disruption in their flow of speech. Repetitive sounds, words, or phrases are also common in the language of Fragile X. Their language is considered very cluttered. Also, they have a very good syntax for their appropriate mental age.
There are many advantages in using sign language with children who have Fragile X syndrome. One is because these children have very strong visual skills. A lot of the time, some of these children can become depressed because they don't have a way to communicate, and so it gives them a communication outlet. And also, ASL is very short and effective, and so sometimes the children have very short attention spans, and so it helps them pay attention and they can communicate easier.
The disadvantages of using ASL with children with Fragile X is that they have a very short attention span. So you must have somebody there to teach them who is persistent and has a lot of time, and who is also very patient. They also have fear of large movements, so signs like excited might scare them and they won't be as prone to learn those big signs. A good tip for using sign language is always use sign with minimal movements. A good sign to use is hurt. This is a good sign because males who have Fragile X syndrome also show aggressive behavior. They do this because by banging their head on the table or the wall because they don't know what to do with all their built-up frustration. So the sign to use is hurt. 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 Another good sign to use with children who have Fragile X syndrome is pay attention. This is a good sign to use because children who have Fragile X syndrome often have short attention spans. So the sign to use is pay attention.
Pay attention!
A good activity to do with children with Fragile X syndrome would be to read a book. And this is good because reading a book is calming, which can also help with their attention span and also pairs auditory cues with visual cues. Tip would be to not read a book or any sort of activity in loud areas.
Look at my crowd. Look at my farmer. You see it? You see my farmer?
Read this book. Do have a quiet area.
The cow jumping over the moon. And there were 3 little bears sitting on chairs.
Another tip is to keep the child in an isolated environment during an activity so they're not distracted.
Good night lights and the red balloon. Good night bears and good night chairs.
Use a colorful book when you're reading to a kid with Fragile X and limited words, like this book.
Auditory input helps with learning and comprehension. So to help prepare a child for changes in routine, use music to indicate the transitions. And a good example of this is the cleanup song.
Okay guys, it's time to clean up.
Clean up, everybody, everywhere. Clean up, everybody do your share. Clean up, everybody, everywhere. Clean up, everybody do your share.
Another tip is to remember not to get frustrated when teaching sign language to children who have Fragile X. It's important to work in several short periods of time instead of long period sessions.
Brought to you by
Amy Wallace,
Kyla Ard.
Morgan Ermis,
Kinsley Powell.